Good afternoon, Minister and distinguished guests. My name is Kirsten. I am joined here today with my fellow task force members,
Devin,
Shweta,
Claudia,
and Kaylee.
Upon your request and support, we have prepared a detailed situation analysis describing the basic health indicators, population dynamics, some trends, and the burden of disease for the Islamic Republic of Pakistan. Pakistan is the sixth largest populous country with a population of almost 200 million people and is located within the region of South Asia, according to the World Bank. It is also a low to middle income country. As a task force, we have come to the conclusion that the top three burdens of diseases are non-communicable diseases, communicable diseases, and the effects of women's education on a child. All of these burdens of disease affect the citizens of Pakistan in different ways. However, we must attempt to solve these issues in order to improve the overall health of Pakistan.
non-communicable disease kills 40 million people each year, imposing the largest health burden in Pakistan. Ischemic heart disease is one of the cardiovascular non-communicable diseases. It is the main cause of death in Pakistan, causing almost 10% of total deaths. The prevalence is increasing over time. The main risk factors of non-communicable disease are smoking, unhealthy diet, and lack of exercise. Those main risk factors are preventable. However, most of the healthcare budget supplies curative care, not the prevention. Increasing anti-smoking social marketing strategy is one of the effective ways to reduce the prevalence. Support and development of education is another good strategy that will have the greatest benefit. Teaching them in the fundamental dangers of an unhealthy lifestyle allows them to spread their knowledge to their families and community.
Currently in Pakistan, communicable diseases are responsible for 38% of deaths. One of the top burdens being malaria, which is responsible for 500,000 deaths annually. Despite it being a vaccine-preventable disease, risk factors associated with malaria are having high fever, chills, sweating, and vomiting. To overcome this disease, we have decided to implement a program similar to the one that was implemented in Botswana by WHO. This first involves finding out who is diagnosed by malaria and then providing them with the proper medication, which involves AL, and if that does not work, there is a second-line drug. Lastly, we will educate children at school about this disease and what to do if they think they have the disease. This will be beneficial as children can tell their family about what is hygienic and what is not, and help make this disease preventable.
The health of both women and children is linked to the education of females. Pakistan ranks third in adult illiteracy due to the cultural views in the majority of rural Pakistan. Majority of women are undereducated and underemployed. Studies show that the more a woman is educated, the more her child's chance of survival increases. In 2015, children of women with no education had an under 5 mortality rate of 112. And the rate for children born to mothers with more than a secondary education was 36, over 2/3 less. Educating females is the main link to the well-being and health of children. Currently, the government of Pakistan is only spending 2.6% of its GDP on education, and because of this, there is a shortage of schools in the rural areas of Pakistan. From the girls who do go to school, they only get up to secondary education because universities and colleges are not considered necessary in rural areas. It is important for the cultural mindset to change in these areas because it is the barrier between Pakistani women and their education. Our task force believes in order to increase women's rights, we must increase funding to organizations that support free education for women in Pakistan. More awareness should be created for foundations that work towards educating children all across Pakistan, such as the non-profit NGOs Zindagi Trust and the Citizens Foundation. These organizations work towards reforming public schools, educating working children, and lobbying the government to improve education policy. These organizations are the key to educating the children of Pakistan, especially young girls, empowering them to become strong women.
Pakistan has a high burden of disease. This includes IHD, malaria, and a woman's education in relation to her child. One of the non-communicable diseases, IHD, has the highest rate of deaths. The communicable disease, malaria, kills 500,000 people annually. And lastly, the education a woman receives greatly affects the societal outcomes of her children. To reduce the prevalence of these issues in Pakistan, the task force team has provided some recommendations. For ischemic heart disease, we recommend increasing prices of cigarettes, causing a lower demand, therefore reducing the consumption, and in turn the number of deaths from ischemic heart disease. For malaria, we suggest that the clinics keep symptomatic patients under observation and treat them accordingly. And lastly, for women and children, We will provide them with accessible education through various foundations. Through these recommendations, we hope that they will create a positive impact in Pakistan.